Hello everyone. Today, this is a brand new episode of our Project IMG interview, and our guest today is Dr. Priyanka, an internal medicine resident who just matched. So she's an incoming PGY1 internal medicine resident. Welcome, Dr. Priyanka. Thank you so much for being here with us, and congratulations once again on the match. It's nice to have you here.
Thank you so much.
Before we
I'm excited to be here.
Yes, definitely. We're also happy to have you here. So before we start, just give us a small introduction about yourself, how you came into the medical field, what your USMLE timeline was like when you finished from medical school, and anything that could make us as IMGs relate better to you.
Sure. As you know, my name is Priyanka Singh. I am originally from India, and I graduated from Smolensk University in June 2018 from Russia. And after that, I moved back to India and cleared my FMGE exam in December 2018. So the first 4 months in 2019, I spent for figuring out my internship and my career pathway. And finally, in May 2019, I decided to do USMLE and spent like 10 months for my USMLE Step 1 preparation, and which I gave in March 2020. So immediately after my USMLE Step 1, I flew to the United States to do my clinical rotations. And despite the pandemic, I was able to do about like 5 months of clinical rotation. And at that time, CS was cancelled, so I was ineligible to apply for the 2020 match cycle. So I delayed my CK, and eventually, after multiple cancellations, I was able to take my USMLE Step 2 CK in May 2021 and OET in June 2021. I received my certification in August 2021, and I was able to apply in September. I also took my USMLE Step 3 in October, which also helped me during my interview season. So this was my USMLE timeline.
That was a whole lot of work within that time frame. Just to digress a little bit, were you happy when CS was cancelled? When you heard that, okay, we're no longer doing CS, like CS is no longer going to be a part of Step 2. Did you feel some sort of relief?
Not really, because I was actually in Houston and I was all set to give the CS exam in April. And they announced the cancellation. And actually, I went to Houston for rotations with the thought that I can practice in Houston, and my test center was in Houston. So I was not happy about
all the preparation. Yes. Okay. So when you were asked on the form about what your primary goal for taking the USMLE was, you mentioned that you never expected it to be a part of your medical journey. You didn't see yourself taking the USMLE exams. So what are the factors that made you pursue this journey?
All right. So when I moved to India and spent like time during my internship, I actually thought more about my career. And one thing I was sure of was I wanted the quality of training. And as we know, like United States offers the best clinical residency experience in the world. So that was my primary reason to do USMLE. And also I have a little bit of academic inclination and the opportunities for academic, there are a few personal factors that pushed me to pursue USMLE.
That's amazing. That's amazing. So since you are done with your graduation from Russia, you mentioned that you finished from Russia, and then you also completed your internship in India. I remember you talking about your FMGE exams, if I'm not mistaken.
Yes.
Yeah. So can you tell us, how did you manage taking both the FMGE exams and the USMLE exams simultaneously? Because we know that both exams are really tough. And what was your strategy and timeline with regard to the two exams, like managing it one after the other, or did you do them together? And how did you manage the difficulties that came with handling both exams at the same time?
Okay. So just for the clarification, I actually did not complete my internship, and because I focused that time to do the non-clinical jobs to support myself financially and prepared for my USMLE exams. And also, like as soon as I graduated, I had 6 months for the FMG exam. And later, when I started my internship, I actually thought about the USMLE. So I didn't do both simultaneously. But to answer your question, like FMG is a 300-mark exam, and out of which 100 marks is solely based on the preclinical subjects. So when you're
Oh.
preparing for your USMLE, you actually prepare for the 100 marks. And additionally, you can count on like other subjects like dermatology, psychiatry, ENT, ophthalmology, which is also a part of USMLE step one. So
Definitely.
total, I think you can count up to 120 marks. So I would advise like preparing both simultaneously, and only during the last 3 months of FMG, one should try to give as many assessments as possible and see the deficiencies and work towards it. But definitely you can prepare for USMLE step one, and that can help you long time in your FMG preparation for sure.
That is amazing. That is amazing. So, what US clinical experiences did you go for? And can foreign medical graduates also do the same while pursuing internships in their home country? So, for instance, you're in India and you're doing. I mean, you started your internship and you still had to like get
Yes,
your
that's
US
right.
clinical
Yeah.
experience. In the middle of the pandemic again, so
Yeah.
that's crazy. So how would you advise foreign medical graduates to go about it, and how did you also go about getting your US clinical experiences?
Sure. So yeah, definitely. Like even the graduates and intern students can do the US clinical experience, which I did. So what I did was I actually preferred the hands-on clinical experiences more than the observerships in the big universities. The
Okay.
reason being that many of the programs clearly mention that observerships are not counted as US clinical experience, and I did not want to put myself in a weak position.
Okay.
So initially, I went through an agency and I did 1 month of rotation there. And I politely requested my attending if he can allow me to do another month, which he agreed. So I paid for 1 month, but I did 2 months of rotation. And I also requested him if he can recommend me to other colleagues.
Yeah.
And meanwhile, I also contacted my seniors from my universities, and if they can recommend me to some doctor with whom I can rotate. I also contacted and emailed the professors and the attendings at different hospitals. It is time taking and it does require a lot of effort, but I believe, like, I think that like the LORs that you get from direct contact are unique to you, and like not many students will have the same LOR, which is not the case when you go through the agencies. So networking is really crucial. The more you network, the better you are, like the better is the amount of LORs you can get and the recommendation. So
Yeah,
yeah.
that is really, really amazing advice, and I hope everyone is learning. I myself am taking away some
I
notes
hope
from what
so.
you said so far. So speaking about LORs, like you just mentioned, how was it for you, like obtaining LORs? For those that don't know what LORs mean, that's letter of reference. How was it
Mhm.
to obtain the LORs you used during your application period, and how many LORs did you manage to upload while during the match season while we're putting in your applications?
Yes. So I was able to upload 4 letter of recommendations, three from my clinical experience, and one was the research letter of recommendation from my research mentor,
Okay.
which I did was like a remote research course. So I think obtaining the LOR is the most difficult part of USMLE. So how one should go about it is like understanding that attendings are very, very busy people. They are not noticing you all the time. So
Yeah.
how to make yourself noticeable is by like working really hard. You have to show up early, go late, ask for weekly feedbacks, not weekly, then at least bi-weekly, and make good relation with your nurses and medical assistants. Do not ignore them. They are also a part of the system. So talk to them and like be friendly with everyone and
Hmm.
courteous, and be proactive with all the work like managing the charts, history, and like the differentials, so that the attending notices you, and that's how you will get a better recommendation. And since we're talking about the LORs and USCE, I will also like to mention that when I say that going by direct contact is really helpful, there is one trickiest thing about it is when you go through agencies and university, they have clearly mentioned on their website whether you will receive a letter of recommendation or not.
Okay.
But when you go through direct contact, I think you cannot ask on the first day that, oh, will you be giving me a LOR? Because
Yeah.
that will be a little bit impolite.
Suspicious.
So you have to, yeah. So you have to actually work for 15 days at least, and then ask the attending that is he comfortable to write you a letter of recommendation. So
Okay.
Mostly they will say yes. And also most of the direct contacts give you the clinic letterhead. So you have to request them to take you to the hospitals, and then only they can give you a hospital letterhead LOR, because clinical letterhead LOR is not as much as value as much as of value as the hospital letterhead. So
Okay.
all these things need like great planning and lots of hard work, and you have to like demonstrate your interest, and just be noticeable to your attending. Do not shy away. Be there. Be proactive.
Thank you so much. But having home country experience, like work experience in your home country, did that add up to your CV? Was it like valuable to your CV? And also, what are the differences and similarities between working in your home country or while you were interning and during the period when you had your US clinical experience? Was there any difference that you noticed? Was there any similarities? And what did those experiences for you during your internship period there? How did it play out in your CV writing and yeah, your application?
Mhm. So I would say definitely like home country experience is an added plus, but my interviewers did not talk about it a lot. COVID-19 experience is valued, but mostly they focus on the US clinical experience. Um, and about the similarities, so I think both the healthcare systems, we are patient oriented and we try to give our patients the best of whatever is available to us.
Mm-hmm.
The differences that I noticed is, especially like when I compare Russia, India, and the United States, is like the EMR system, the different insurance, and especially in the United States, I realized that we practice a lot of preventive medicine. We practice it back in home as well, but it is not as widely practiced as in the United States. Yeah.
Okay. Oh, that's something new that I've learned. I didn't know about that. So you mentioned working as a medical content developer in your form submission. So did you add this to your CV, and how was it able
Yes.
to play out during your interviews? Were you asked about it? How did you even come across the job as a medical content developer? Because I'm sure that there are some people that are thinking, what is a medical content developer? This is my first time hearing about it. How do I go about
Yeah.
it? Yeah. So did that play a role? Did you add it to your CV, and were you like questioned about it during your interviews?
Yes. So actually, while I was looking for non-clinical jobs, I tried to search for jobs which helped me in my resume and CV. So
Okay.
like USMLE tutoring, medical content developing, telemedicine. So I looked it up on at Indeed, and I found this job as medical content developer in a leading medical platform in India, which is PrepLadder. And my responsibilities included like uh, creating notes from the videos and creating the question banks and writing the notes and making the flashcards. So basically, I requested the recruiter if they can allot me the team, which is focusing on the preclinical subjects because I'm
Okay.
preparing for so and so exam. And the recruiter agreed to it. So that's why I say always ask. So they agreed to it, and it really helped me a lot because I almost feel like they paid me to study.
Mhm.
So it was wonderful. And yes, even during my interviews, they did ask about the job. So I used it to leverage my skills, like working in large teams, because for 19 subjects, we had like so many teams working with the graphic team, publishing team, editing team. So I
Yeah.
showed them my teamwork skills. I also showed them like how strategic and organized I am, because like I was choosing my jobs, which aided in my CV. So I
Yes.
talked about my resourcefulness there. So yeah, it did help me in my interview.
Oh, that's amazing. Also, you mentioned about your personal statement that it got a lot of good
Mhm.
reviews. So, what do you think
Yeah.
made your personal statement stand out, and what advice can you give the viewers and the IMGs that are watching this interview today on writing a good personal statement?
All right. So I think a personal statement should reflect your personality. To be like very clear. So I did talk about like why I chose medicine and why I am inclined towards a particular specialty. But I also talked about like my other parts of my life, like my family, my friends, particularly because like I spent like 6 years in Russia and they were an
Yeah.
integral part of my life. So I talked about them. I talked about my experiences in Russia, in the India, and in the US. So, like one interviewer told me specifically that, okay, so after reading your personal statement, I know who Priyanka is, and I think you are pleasant to work with. So I would say, like, demonstrate your personality apart from being like instant, like along with showing your medical personality, you should also show your non-medical side, because like you're a human being, so you should show your emotions, your other activities in your personal statement. That is my advice.
That is amazing. Thank you so much for that amazing advice.
You're
Then
welcome.
also, with the entire pandemic going on, you know that a lot of IMGs are facing a lot of
Mhm.
challenges,
Yeah.
whether with obtaining visas or US clinical experience. I mean, you mentioned how with COVID, how hard it is to obtain a US clinical
Yeah, right.
experience, and even financial challenges. So, what were some of the challenges you had to face, and how did you overcome those challenges to do what you needed to do?
Okay, so I faced all of them, whatever you mentioned. So we already talked about like USC. It was so hard, and I remember like I secured a research volunteer position at a prestigious hospital in the US, like like at the later stages, the hospital denied to issue the ID card to the visitors. So I lost the position. I overcame it by joining the research course instead and worked remotely and
Mhm.
got my publications or whatever I needed to do. And same for visa. My visa was rejected once because of the sponsor issue. So the next time I applied, I added two sponsors, and that helped. And for the financial things, I always worked. Like I worked from day one of my USMLE. Either I was doing USMLE tutoring or medical content developing, or I also did a little bit of telemedicine.
Oh, that's
So
nice.
I tried to overcome like things as much as possible.
Yeah, that's amazing. You like you said, like you're really, really resourceful, and like that has shown so far. And
Thank you.
were you actually a visa requiring IMG? I know you talked about, you just mentioned
Yeah.
about needing a visa, and also how many programs did you apply for, and how many interviews were you able to secure? And not even only that, let's say post interview, what were the factors you that came into your mind when you had to rank those programs?
Yes. So I applied to a total of 175 programs in internal medicine, and I received 6 interviews. Now that is scary because like the NRMP mean to match is 7 interviews. So
Hmm.
I was as having one less. So it was a little bit scary, but I would say the biggest mistake that I did was in the supplemental eras. I signaled few of the geographical areas. So when you signal few geographical areas, the other areas get the information that we don't have the information. But when you don't signal any area at all, so it clearly states the applicant has no preference. So I think I made a big mistake there, because the people with my similar credentials, they received interviews from the places in the hospitals that I didn't even know like lied in that geographical area. So I
No.
would say that if supplemental eras is there in this like in the upcoming season, I would say if you really do not have like strong family ties, and you do not want to move at all, then only signal a particular geographical
Yes.
area, because it's scary. Yeah, it didn't work out well. For the ranking, I really used my interview day vibes, how I felt when I was talking to the program directors and the faculty. I think medicine is all about mentorship. So I really want a program which invests in my career in the 3 years. So I did use that as a ranking factor, that how
Okay.
friendly the program director and faculty is. Secondly, like university versus community program,
Mhm.
academics, how much of academics and research opportunities do I have? And also because I'm an visa requiring candidate, I did think over H1B versus J1. So these
Mhm.
were the factors that I considered while ranking. So I would say, like, actually during ranking, I did not consider geographical location, but during the supplemental eras, I did. So I
Yeah.
shouldn't do that.
Oh wow, that's amazing. What are your future prospects now? Moving on. Are you planning on doing any fellowship, post residency? Do you just want to go into research? Do you have any future prospects right now?
I don't think so. As of now, I'm really just enjoying and relaxing my time. I don't think like I would think about like the coming next year for any fellowship or so on.
I
We'll
mean, at
see.
least for now, just take this time and enjoy the fact that you have
Yeah,
matched and the victory that comes with
yeah, that's
that.
right.
So, what message do you have for our fellow IMGs that are listening to you today? What would you like to tell them? Any word of encouragement or any last piece of advice?
Okay, so I would say, so firstly, like I'm also a very shy person. I also have sometimes difficulty understanding the patient accents. I do make grammatical mistakes, but please do not be hesitant about all of these things. What matters is how you try to overcome it. Be confident and do not be hesitant to ask. If you don't ask, the answer is always no. I
Yeah.
can't tell about the stories where I'm like so disappointed because I missed an opportunity because I did not ask and I was hesitant. So you
Mhm.
do not want to do that. You have to keep asking. For like 100 no's, you will at least get one yes.
Definitely.
So just do not be disheartened and keep going on and just ask. Yeah.
It's really been an amazing time with you, Dr. Priyanka. Like, we've learned a lot from you today, and I'm sure that a lot of us IMGs who have heard things that we haven't heard before, and for some people who are going to come in for the next match season, at least they have certain things to take away from this interview. And it was really, really nice talking to you, and this was very, very informative.
Same here.
Thank you so much for your time. Like you said, it's been amazing, and we wish you all the best in your future endeavors and all your
Thank you
future
so much.
prospects. Thank you so much.
Thank you. All the best to you as well and
Thank you.
everyone. Thank you so much for having me.
Yeah.